We are encouraging the society to be open about the health knowledge. It's no longer taboo to talk about sexual matters. It's no longer taboo. Gone are the days we used to tell our children that we buy children from the supermarkets.
My name is Martin Lunala. I'm the Executive Director for Reproductive Health Champions Organization, working here in Nakuru and at the country level. All of us are a family, and this family is a unit that is even recognized in the Constitution under Article 45. That is saying that we need to make sure that we are promoting this family, and it's decentralizing its values under Article 10, where we are talking about national values and principle of good governance. Under the national values, we are just saying, as a family, we need to have one value. And that value should be making sure that everyone lives safe, everyone is feeling loved, and everyone can access the required healthcare services at the bare minimum as enshrined in Article 43, where we are talking about social rights and social and economical rights. So today, as we gather here today, we just had a discussion with the religious institution and members of the public, and together with other leaderships from whichever diversity group they have come from, to just understand what's a family for us. And majority of the communities have known us for being radical when you talk about rights. We're just saying, as a family of practice, we are here to say we are also going to churches. Some of us are even pastors. I myself am a leader in my church, and we are practicing that leadership role in our churches. And therefore, when you're on the street, it doesn't mean that we hate that cohesiveness. I want to share that today we are calling upon the government of this country that we've heard you talk about SHA, we've heard you talk about CHIF, we've heard you talk about NHIF, and majority of women are dying in these facilities. We've seen them not getting out alive. And that has even disconnected the families, because when we as a husband, when I take my wife to a facility, for a maternity facility, to get that delivery service, and I go home with a kid without a mother, that already has disconnected my family. And this, I know men do not speak, but a lot of men are suffering out here because they cannot they cannot tell their children who their mother is, because already the mother got lost in the facilities. Another thing that we are seeing as men is that some of our families forces us to have children, and even when you try to have some, you go to the hospital, your wife delivers very well, but now because of the shaky infrastructure in the maternal facilities, we lose those kids that we give birth from the facilities, and therefore you and your wife or husband go home barehanded, and people feel like you are cursed because you never have kids that you can show to the public. So we are just saying, as a family, we want to feel this pain together. We want to feel the pain in the church, because again, if the pastor is in the pulpit and they do not have the congregants, and the congregants are us, because we have died, we have HIV positive people who have died early because there is no medication in the facilities, then automatically the church will be empty. If you go to the mosque and you cannot even give offering, because of all of us, we have anemia, we are diarrheaing everywhere. So I think even that infrastructure and environment will not be safe for us. So as a family, we need to be clean, we need to be safe, we need to be unique, we need to support each other. And I'm so happy for the religious leaders led by Pastor Jiteri, who has just said, contraception is something that the church is afraid to say. But at the same time, the church is also preaching, saying that the children are not, majority of the teenage pregnancies that are arising are children who are also going to church, because they are there. Is it that there's a disconnect in the scripture? Can we then also link the scripture to the normal social life as a religion? Can we link the scripture with the constitution? Because all of us, we are here, we are under the sun. We are not yet in heaven. So as we go to heaven, the religious will have done their part. And as we are in the legal processes, we'll have told the public what are the economical rights that they have. We are making just sure that even the university students they are saying, sex is good. And musidanganye, and you guys are afraid to say these things because you think it's not ethical to media. Sex is nice. If there was no sex, we will not be here today. But sex at the right time, sex that is protected, sex that will give birth to something you wanted, not unwanted one. Majority of families are giving birth to unintended children. That's why we can see even the spacing is a problem. You have 18 kids from 17 mothers, and then every mother is taking you to court, because you are not taking care of those offsprings. And then you are not in a position to take care of the court itself. You cannot have 17 lawyers, because every court has its on every case is in its own court. So I think it's very important we bring these diversities together, rally this call together, work as a family. You are our family. The church is our family. And the good thing about here, I think in the morning, you heard everyone is introducing themselves from the church they go to, the mosque they are associated with. So, and then we ask ourselves, if all of us were going to church, then how comes the society is what it is today? Is it the scripture? Is it us? So coming together today is one of the milestones that we will not forget, and we'll just want to wish that even the Republic of Kenya understand that we are a family. We are a family. Being a sex worker does not make me not to become a parent. Doesn't stop him from being a father. If I got child at the early age, it should not criminalize me from having a wedding in a church because I got a child at my early ages. And the funny thing today I've heard, even the pastors, including Chiteri, who has said very well here, it's very clear that not the church they were born in, the church they are in today. Someone started with Catholic, they are ending up in something else. Some others started with something else, they are ending up with Catholic. Some were Christians, they are ending up as Muslims. Some were Muslims, they are ending up as Christians. So it means we need just this cohesion. We need to coexist and help each other.
My name is Pastor Javan Chiteri. We find ourselves engaged in this conversation so that we may be able to put any doubt that may be pertaining about the workings of the two to rest. As a church, we acknowledge and embrace health issues. We embrace health knowledge because it's across the globe, it's well known that out of health, we are able to get clinical services. We are able to get knowledge that will be able to guide our children, our families on matters health, and even seeking medication to correct the wrongs that may be in the society. We all know as medics, they treat, but ultimately the healing comes from the Lord. And that is why you cannot separate the two. They work hand in hand, and health issues nowadays, when you blend with faith, we are encouraging the society to be open about the health knowledge. It's no longer taboo to talk about sexual matters. It's no longer taboo. Gone are the days we used to tell our children that we buy children from the supermarkets. That was very wrong. Nowadays, we are encouraged, even as a church, that we open health knowledge to our children. We open knowledge to all that may be able to listen, because we are encouraging the church to work in tandem with the health sectors. We are encouraging sexual education even to be accorded to students in schools. And I want to speak very positively about what the government has done. Sexual education has now been introduced in schools. The kids now are growing knowing very well sex is not bad, but it's right when it's done at the right time. When one is of age, that is allowed. So we cannot keep on saying that we cannot talk about sex. Health issues, they are cutting across. It doesn't matter the religion that you are from. So long as you are able to articulate in a perfect way to encourage health issues to be articulated rightly across, then you are on the right path. I encourage the church, the religious societies, to come very openly and speak about health matters, to speak about sex issues, that our children may grow knowing very well that these are things that are no longer taboo in the society. But even so, when we find our children involved with such matters, when you find your child has already committed a wrong, as young as they are, they find themselves being young parents. We don't condemn them in the society. We speak to them. We let them know, yes, it has happened, but that is not the end of life. They must embrace the situation they are in. They must be encouraged in that situation they are in. So that at the end of the day, we may even be able now to bring them on board, to be among the teachers who are able to educate others that yes, they found themselves in this given situation, But that was not their choice. So for the rest, it may not have been happened, it may not have been happened, it may not have happened the right way. But let it be a learning lesson to others. So let's combine health knowledge and the Christian knowledge for the betterment of our society. I believe with that, we should be good to go, both as a church and as the health sectors.
So my name is Livia Bosibori Nyakundi, a senior medical student of medicine and surgery at Egerton University. I'm also a volunteer with the Reproductive Health Champion Organization and a student leader. So the statistics are there. The statistics are there that most students or most girls and young men don't lack the adequate knowledge to matters pertaining to sexual and reproductive health rights. So some of the challenges that we face, number one is we don't have the necessary access to some of these toolkits that will help us. Like for example, the condoms. We notice that the supply of condoms has not been there in the institutions. Therefore, youths are just engaging carelessly because they're young people and they can't stop their needs or prevent, or they just have to engage. So leading to the high numbers of HIV cases and unintended pregnancies. Again, we have clubs, like from my institutions, we have the clubs that champion for sexual and reproductive health rights, but they don't get the necessary support in terms of funding. They want to conduct some of these awareness or outreaches to the community, but because they lack funding, that is a hindrance in itself. So they just keep operating from within, and they're not able to do much with what they would love to do. And then another key challenge that students have, people don't have the necessary information, adequate knowledge, what is sexual reproductive health rights. Then the students don't also have enough support. Like those students who end up being pregnant or who are infected with HIV and AIDS, what is next for them? They don't have the necessary support. You just find that they have the recovery center at the Nakuru County and Referral Hospital, just one center in the whole county, Nakuru County. What's next for them? So we are just calling upon the government and all organizations, if they can support these students to conduct such outreach activities, supply them with the necessary contraceptives and tools so that we are able to have a healthier society. Thank you.
Mi naitwa Deborah Nyango, natoka London Ward. Mi ni kijana kutoka informal settlement ya Hilton. Pia na work na organization inaitwa Black Coffee Network. So number one, nataka kusema a healthy family is a happy family. Na huwa tuna separate reproductive health from health. Kama reproductive health ijaikuwa incorporated in health, tutakuwa na healthy family. Number one, family inaanza aje? Family inaanza kwa basic unit where you have father, mother, and children, ama parents and children. Tunapata watoto aje? Tunapata watoto through reproductive health and rights. So sisi kama vijana kwanza huko juu tuna face issues za reproductive health, na number one ni information. Atupati the right information. Ama tunapata information kutoka kwa wazazi wetu, but see the right information. Number one, sisi huwa tunaambiwa sex is a sin, ama kufanya ngono ni mbaya, na niyo kitu ndo tumejua kutoka tukue wachanga. Kwa hivyo venye pastor alisema, lazima wazazi tukue able kuongelesha watoto wetu kuhusu sex. Wajue hii sex ni nini, what are the effects kufanya sex kama wewe ni mdogo. Basically wakuwe na the right information so that wakikuwa wakubwa, they grow knowing this information or pass on to their children. Number two, kuna a lot of stigma kwa community, especially when it comes to as a single family where there is maybe a single father or a single mother. Hii ni family huwa inaonekana ni kama ni incomplete family. But sasa nini na happen kwa watoto wana grow up kwa such families? Watoto wengine wanaending up kukua wazuri from such families. So just stigmatizing our watoto kwa sababu wanatoka kwa such families, ama stigmatizing their parents kwa sababu maybe aliachana na baba ya mtoto ama mama ya mtoto is also one of the challenges. Another one is access to these services. Services kwanza ni expensive. Mnataka watoto wasizae out of ama vijana wasizae out of marriage, na at the same time mnawanyima contraceptives. At the same time mnawanyima information, the right information on how to maybe not get the same children wenye bado mna stigmatize wakitoka kwa single families. So number one, to the government, provide these services. Number two, to religious institution. create a safe space where vijana wanaweza kuja waongelee hizi issues, zina face, at the same time wapate information and the right information. Number 3 is to parents. Talk to your children. Talk to your children about sexual and reproductive health. Tell them the right information and tell them as it is. Usikuote ati mtoto anatoka kwa supermarket. Hiyo age tulipita. Social media sasa inafunza watoto penye watoto wanatoka, inawafunza about sex. So give them the right information. And number 4, to CSO world. Tukae pamoja, tushirikiane ili to ensure that hizi reproductive health and rights zinapatiana kwa watoto wetu na pia kwa kila mtu kijumla. Like I said, a healthy family is a happy family.